going to be the first analysis of the pancreatic cancer data which have been collected by the group. Here you see the map of Hungary and the 14 centers which provided pancreatic cancer data. Altogether, up to the end of October, 317 patients have been introduced to this database. The data collection period was 2012 to 2014. However, the median follow-up is longer because those patients who were diagnosed with the disease earlier were also introduced to the database. The mean age of the population was 66 years, and almost 300 blood samples and 33 tumor samples have been collected. First, I would like to introduce some data on etiological factors. As you see on the slide, about 1/3 of the population, in 1/3 of the population was the medical history on alcoholic consumption, and 2/3 we didn't have data on alcohol consumption. Regarding family history, only in 18 cases was positive, the family history. About 1/3 of the patients were diabetic, and 41 insulin dependent and 60 non-insulin dependent diabetic patients. Regarding the symptoms, diarrhea was found in 50 or more than 50 of the patients. Icterus was very highly present in the population, and weight loss was present in more than half of the patients. This is a very usual data that almost 10 kilograms of weight loss was reported. Here you see a quite normal BMI as an average of the population. However, if you look at the range, it represents the various or diverse etiology of the disease. So at the diagnosis, there was very low and very high BMI indexes. Some data on the tumors, very high tumor marker levels showing the advanced stage of the disease in most of the cases. And in more than 100 patients, palliative biliary, and in almost 40 patients had a palliative surgical intervention, and about 100 had just a stent implantation. Histology was not reported in all cases. As you see, it's just an analysis of 136 cases. Most of them had adenocarcinoma, not detailed which type, and just a very few patients had other histological result. Most of them was neuroendocrine carcinoma. Regarding oncological therapy, only a minority of the cases was reported as having chemotherapy, and except one lymphoma case, all received gemcitabine-based chemotherapy. Palliative treatment was needed in 1/3 of the patients, mainly analgesics, minor analgesics, but 30 patients had to have opiates, and some patients, both of them, was reported as gut. Pancreatic enzyme substitution was given to almost 50 patients. We have some survival data. As you see, the median follow-up was about 5 months. However, the range was much wider, and fatality rates are not so high as reported in the literature. However, we think that this is not that accurate data, and probably many of the patients were not reported regarding the survival status. The median overall survival time for the whole population was almost 6 months, which is in consistence with the literature data. And those who had chemotherapy, maybe they had a longer overall survival time, but in fact, the fatality rate was almost the same as in all the other groups. Adenocarcinoma patients, since they were quite a number, I also analyzed, and the fatality rate was very similar to the overall population, of course. The median overall survival time was 7 months. And none of the Panin patients died, and 2 of the NET cases died. However, all had a very long survival. And the future plans, we definitely would like to improve the database and the outline of the questionnaires. So we constructed or developed these questionnaires into a more structured and more accurate one by giving multiple choice questions to those who fill it out. And the questions will be grouped into demographics, to risk factors. A very wide range of risk factors are put to the questionnaire, to the patient-related data, to the tumor-related data, and regarding oncological therapy, we will need more data. And some questions and words about follow-up are also included. We believe that this kind of work will initiate valuable basic research, translational research, and clinical research, including prospective clinical trials. Thank you very much for your attention.
The paper is open for discussion. Okay, if no questions, it seemed to be for me that just a few patients got major analgesics for treating the pain associated with pancreatic cancer.
We all know that the symptoms depend on the location of the tumor and also on the stage of the tumor. And finally, I am not sure that all the questions were answered in this database. This is really a beginning of collecting the data. So I think it is essential to give a kind of quality control and a data manager who will discover the answers if they are lacking. So I am sure that in the future it will be easier to answer your question. Thank you very much.